Thanks, Ron. Well, racism is an ongoing issue that shows no signs of receding in our current national climate, and an important event is coming up to educate and enlighten the public. Reverend Gerald Arnold is here. He's a civil rights activist, a member of the NAACP, and he's here with Dr. Thomas Stratton of ECHO. And welcome both the Lifestyles, gentlemen. Glad you're both here.
Thank you very much.
And you just came off an event a couple of weeks ago or a week ago, and now which goes to my point that we keep talking about these same issues and they seem to not get better. So we're talking about the disparity in institutions and medical services. So Tom, I'll turn to you and say, what are the problems on the ground as we face it right here in the tri-state?
Well, I will start with this because I think it's telling many years on after these words were first uttered. Of all the forms of inequality, injustice in medicine is the most shocking and most inhumane. And the person who said that was Martin Luther King, and he said that in Montgomery following the march from Selma, a march which was organized, of course, around voting rights. But we could see at that time, visionaries like him and his allies could see at that time how the challenges in society and the challenge of bigotry and racism were linked together across all institutions. So here we are 50 years after the Civil Rights era, a century and a half after the end of a war that was started to defend slavery. And we have, as a society, in many respects, have yet to settle the accounts for slavery and segregation. Every institution, including medicine, has been touched by and participated in this challenge. And we are going to look at a number of ways in which that has borne out through history, including access to health care, including how medical research has been conducted. Some very challenging stories there. Much of it is painful. We cannot pretend it didn't happen, and we cannot ignore history lest we suffer the odds of the chance of reliving it or repeating it. We are going to look at the ways in which what we call the social determinants of health tie into healthcare outcomes. So healthcare is more than medicine. It's more than prescriptions. It is affected by where and how we live. It is affected by our neighborhoods and infrastructure, our housing or lack of housing, our education system, our jobs, our workplace safety. So many of this ties together.
So this is a comprehensive conversation we're going to be having about this huge subject that impacts our community in such a powerful way. When is it going to be?
This is going to be on June the 16th, Saturday, at the C.K. Newsom Center from 12.
It's going to start at 1?
Start at 1 to 3, from 1 to 3.
And this will be a panel discussion, or how is this going to play out that day?
Will be a panel discussion from the audience as well.
To asking questions and really addressing some of these issues here and what's being done in our community.
What's being done in our community. And to speak for ECHO, I am on the board of directors here, and this is a great opportunity from the executive director to Dr. Stratton to partner with us to keep a visual on what's happening in healthcare, and minorities are still a challenge, and it has been a challenge, and as we talk about repeal and replace, you know, it's going to roll us back to where we were less than 5 years ago.
Well, thank you both. I mean, we could talk about this forever, so come back and let us know. So this is coming up at the C.K. Newsom Center, 1 to 3 on June 16th. Don't miss the opportunity to have this conversation. Thank you both.
Thank you.
We'll be back with more Lifestyles right after this.